but one particular angle that I kind of learned in those years in healthcare is that clearly healthcare can help to fix a problem once it occurs, but the best way to stay healthy is not to have problems to begin with. And the best way to improve your prognosis, the best way to stay healthy over time, in my opinion, is appropriate nutrition. That's something I came to see from someone who was a fairly careless eater maybe 30, 40 years ago. Over the years, I became more and more interested in just about the right nutrition and how to balance the nutritional aspect on the one hand with taste on the other hand. And so these days, this is not only a job for me, it's also a hobby.
Well, so it's so fascinating. There's so much about what you said. The first idea is that, I think it's very common for young people to look at healthcare and food and nutrition and medication all as just kind of one set kind of master solution. But that's kind of a new idea, the idea that food is medicine. And I think that's quite interesting. But the thing that you said that fascinates me the most is the idea that if it doesn't taste good, people won't do it. And
absolutely. So taste is the number one decision criterion. And so that's why having the perfect food from a health perspective that gets neglected by consumers is no solution. So it has to be a balance. And by the way, it's not about all of these dimensions combined into each and every food item. It's more about the complete diet. So if you follow generally a healthy diet, there is room for some indulgence. And it's important to be aware of that.
Well, I think there'll be some people thinking Nestlé and knowing your famous products in the chocolate world, and the CEO from a healthcare background talking about nutrition right off the bat. How do you address when people ask you about that?
Well, I mean, a lot of people in the States do know us for our presence in chocolate, which of course is one of our historic pillars of the business. But these days, and for many decades now, it's been so much wider, really covering virtually every food and beverage segment, coffee, pet care, center of the plate items, sweets, ice cream, and also infant nutrition and medical nutrition for special medical purposes. So I think we're covering the whole gamut, and that gives us a very broad exposure to when people consume food and beverage.